Absorption of oral iron preparations can be facilitated by co-administering ascorbic acid. The gut controls the entry of ingested iron in the body by complexing excess iron to form ferritin, which remains stored in the mucosal cells and is shed off. In the iron deficient state, transferrin receptors increase in the number on the erythropoietic cells. The percentage of elemental iron in hydrated ferrous sulfate is 0.2. Select the oral iron preparation which does not impart metallic taste and has good oral tolerability despite high iron content, but whose efficacy in treating iron deficiency anemia has been questioned. Iron hydroxypolymaltose. The daily dose of elemental iron for maximum hemopoietic response in an anemic adult is 200 mg. The side effect which primarily limits acceptability of oral iron therapy is epigastric pain and bowel upset. Choose the correct statement about severity of side effects to oral iron medication. Tolerability depends on the quantity of elemental iron in the medication. The following is not a valid indication for parenteral iron therapy. Anemia during pregnancy. Iron sorbitol citric acid differs from iron dextran in that it cannot be injected IV. Choose the correct statement about iron therapy. Prophylactic iron therapy must be given during pregnancy. A patient of iron deficiency anemia has been put on iron therapy. What should be the rate of rise in hemoglobin level of blood so that response is considered adequate? 0.5 to 1%, 1 gram percent per week. The following chelating agent should not be used systemically to treat acute iron poisoning in a child. Dimer Capral. Megaloplastic anemia occurs in either vitamin B12 or folic acid deficiency. The metabolic reaction requiring vitamin B12 but not folate is conversion of malonic acid to succinic acid. The daily dietary requirement of vitamin B12 by an adult is 1 to 3 microgram. The following factor is required for the absorption of dietary vitamin B12: gastric acid and gastric intrinsic factor. A 60-year-old patient presented with anorexia, weakness, paresthesia, and mental changes. His tongue was red, tendon reflexes were diminished, hemoglobin was 6% with large red cells and neutrophils, had hypersegmented nuclei. Endoscopy revealed atrophic gastritis, deficiency of which factor is likely to be responsible for his condition. Vitamin B12. Features of methylcobalamin include the following. It is an active coenzyme form of vitamin B12. It is required for the synthesis of S-adenosyl methionine and it is specifically indicated for correcting neurological defects of vitamin B12 deficiency. Hydroxycobalamin differs from cyanocobalamin in that it is more protein bound and better retained, and it is beneficial in tobacco amblyopia. Megaloplastic anemia developing under the following conditions is due entirely to folate deficiency, not associated with vitamin B12 deficiency. Phenytoin therapy. A patient of megaloplastic anemia was treated with oral folic acid 5 mg daily. After 2 weeks, he reported back with cognitive deficit, sensory disturbance, depressed knee jerk, while blood picture and hemoglobin level were improved. How could be the most likely explanation? So, patient has folate reductase abnormality in the nervous system. Folinic acid is specifically indicated for counteracting toxicity of high dose of methotrexate. Recombinant human erythropoietin is indicated for anemia in chronic renal failure patient. A patient of chronic renal failure maintained on intermittent hemodialysis has anemia not responding to iron therapy. Which of the following additional drug is indicated? E-poietin. Vitamin K is indicated for the treatment of bleeding occurring in patient of obstructive jaundice. Choose the preparations of vitamin K that should not be injected in newborn. Menadione and menadione sodium diphosphate. Menadione, that is vitamin K3, can produce kernicterus in neonates by inducing hemolysis and inhibiting glucuronidation of bilirubin. Select the correct statement about ethamsalate. So it checks capillary bleeding. The primary mechanism by which heparin prevents coagulation of blood is facilitation of antithrombin third mediated inhibition of factor 10A and thrombin. Low concentrations of heparin selectively interfere with the following coagulation pathway. Intrinsic pathway. Low doses of heparin prolong activated partial thromboplastin time. The following actions of heparin are essential for inhibition of factor 10A. Induction of configurational change in antithrombin third to expose its interacting sites. The following is true of heparin except heparin is the physiologically active circulating anticoagulant. Low molecular weight heparins differ from unfractionated heparin in that they selectively inhibit factor 10A, they do not significantly prolong clotting time, and they are metabolized slowly and have longer duration of action. Low molecular weight heparins have the following advantages over unfractionated heparin except higher efficacy in arterial thrombosis. Low dose subcutaneous heparin therapy is indicated for prevention of leg vein thrombosis in elderly patients undergoing abdominal surgery. Heparin is contraindicated in patients suffering from the following disease except bleeding due to defibrillation syndrome. The following can be used to antagonize the action of heparin in case of overdose. Protamine sulfate. Blood level of which clotting factor declines most rapidly after the initiation of warfarin therapy? Factor 7. The following statements are true of oral anticoagulants except they interfere with an early step in the synthesis of clotting factors. You are treating a patient of deep vein thrombosis with warfarin. What value of international normalized ratio will you attempt by adjusting dose of the anticoagulant for an adequate therapeutic effect? 2 to 3. The following drug reduces the effect of oral anticoagulants. Oral contraceptives. The most clear-cut beneficial results are obtained in the use of anticoagulants for the following purpose: prevention of venous thrombosis and pulmonary embolism. Anticoagulant medication is indicated in immobilized elderly patient. Use of anticoagulants in acute myocardial infarction affords the following benefit: it prevents venous thromboembolism. The most effective drug for prevention of stroke in atrial fibrillation patients is warfarin. Select the fibrinolytic drug that is antigenic. Streptokinase. Which fibrinolytic agent selectively activates fibrin-bound plasminogen rather than circulating plasminogen? Alteplase. The most important complication of streptokinase therapy is bleeding. Thrombolytic therapy is indicated in the following conditions except stroke due to cerebral thrombosis. A patient of acute myocardial infarction has been brought to the ICU What is the time lapse since symptom onset beyond which you will not consider instituting thrombolytic therapy? 16 hours. Thrombolytic therapy instituted within 3 to 6 hours of onset of acute myocardial infarction affords the following benefits. It reduces mortality, reduces area of myocardial necrosis, and preserves ventricular function. The, the preferred route of administration of streptokinase in acute myocardial infarction is intravenous. Streptokinase therapy of myocardial infarction is contraindicated in the presence of the following except ventricular extrasystoles. A patient has an episode of hematemesis following streptokinase infused for the treatment of deep vein thrombosis. Which of the following drugs would be most effective in controlling the bleeding episode? Epsilon aminocaproic acid. Tranexamic acid is a specific antidote of fibrinolytic drugs. Aspirin prolongs bleeding time by inhibiting the synthesis of thromboxane A2 in platelets. Inhibition of thromboxane synthesis by aspirin in platelets lasts for 5 to 7 days because platelets cannot generate fresh thromboxane synthetase and their turnover time is 5 to 7 days. The following drug increases cyclic AMP in platelets and inhibits their aggregation without altering levels of thromboxane A2 or prostacyclin. Dipyridamole. Choose the correct statement about ticlopidine. It prevents ADP-mediated platelet adenyl cyclase inhibition. Choose the drug which alters surface receptor on platelet membrane to inhibit aggregation, release reaction and to improve platelet survival in extracorporeal circulation. That is ticlopidine. Ticlopidine is recommended for the following except to reduce neurological sequelae of stroke. The following is true of clopidogrel except it is a GP2B third A receptor antagonist. The following is true of abciximab except it is antigenic. Combined therapy with dipyridamole and warfarin is recommended in subjects with the following, that is Buerger's disease. Indications for the use of antiplatelet drugs include the following except disseminated intravascular coagulation. Choose the most potent and most efficacious LDL cholesterol lowering HMG coenzyme reductase inhibitor, that is atorvastatin. The following is true of simvastatin except it does not undergo first pass metabolism in the liver. Select the most appropriate hypolipidemic drug for a patient with raised LDL cholesterol level but normal triglyceride level, that is HMG coenzyme reductase inhibitor. Select the drug which reduces cholesterol synthesis in liver, increases expression of LDL receptors on hepatocyte and has been found to reduce mortality due to coronary artery disease, that is simvastatin. The rare but characteristic adverse effect of HMG coenzyme reductase inhibitors is myopathy. Features of atorvastatin include the following: dose to dose most potent HMG coenzyme reductase inhibitor, higher ceiling of LDL cholesterol lowering action than lovastatin, and antioxidant property. Select the hypocholesterolemic drug which interferes with intestinal absorption of bile acids or bile salts and cholesterol and secondarily increases cholesterol turnover in the liver. Cholestyramine. Gemfibrozil has the following features except it lowers plasma LDL cholesterol to a greater extent than triglycerides. Anti-atherosclerotic effect of which class of hypolipidemic drugs may involve additional mechanisms like improved endothelial function, reduced LDL oxidation, and anti-inflammatory property. Statins. Select the hypolipidemic drug that enhance lipoprotein synthesis, fatty acid oxidation, and LDL receptor expression in liver through peroxisome proliferator activated receptor alpha. Bezafibrate. A patient with coronary artery disease has raised serum triglyceride level but normal total cholesterol level. Which hypolipidemic drug should be prescribed? Gemfibrozil. The following is true of bezafibrate except it increases the incidence of myopathy due to statins. Choose the correct statement about lovastatin. It is competitive inhibitor of the rate limiting step in cholesterol synthesis. Which of the following hypolipidemic drug is most effective in raising HDL cholesterol level and lowers serum triglyceride? That is nicotinic acid. What is true of nicotinic acid as well as nicotinamide? Both possesses vitamin B3 activity. Pre-treatment with the following drug can be employed to reduce intolerable flushing, warmth, and itching caused by nicotinic acid when used for lowering plasma lipids. Aspirin. Which hypolipidemic drug has been used to control and prevent pancreatitis in familial hypertriglyceridemia? Nicotinic acid. Select the first line hypolipidemic drug for treating hypertriglyceridemia in a patient with normal cholesterol level. Fibrates and nicotinic acid. Specific drug therapy to lower serum triglycerides in a subject with normal LDL cholesterol level is indicated in subjects with existing coronary artery disease and serum triglyceride level greater than 150 mg per deciliter, and in subjects with HDL cholesterol less than 40 mg per deciliter and serum triglyceride level greater than 150 mg per deciliter. In a 50-year-old male without any other coronary artery disease risk factor, hypocholesterolemia drugs are considered necessary when the serum LDL cholesterol level is higher than 190 mg per deciliter. High molecular weight pharmacodynamically inert non-antigenic substances which form colloidal solution are used as plasma expanders. As a plasma expander, dextran has the following advantages except it does not interfere with the grouping and cross-matching of blood. Hydroxyethyl starch is plasma expander. Plasma expanders are used in the following conditions except congestive heart failure.